I have malignant cells, essentially being told that you have cancer. Very, very scary.
His world was turned upside down.
In all honesty, there was very little hope that he would survive another 6 months.
At this point, he starts worrying about dying.
What else is out there?
Anything that was out there, I was going to consider.
Everybody is an individual, and everybody's treatment plan should be individualized.
There are other options.
Welcome to The Incurables. I'm Don Wildman. Of all the forms of skin cancer, melanoma is by far the deadliest. It accounts for more than 75% of skin cancer deaths. Melanoma is especially lethal when it has metastasized or spread beyond the initial site of origin and begins traveling throughout the body. At that point, it is almost impossible to stop. Joe Brown was a young college student when a lump on his neck surfaced and started him on a harrowing, years-long roller coaster ride of physical and emotional trauma. But Joe's story is one of unwavering hope and determination, an inspiration to the people he now reaches as a result of his battle against one of life's deadliest cancers.
He was a healthy young boy with no worries in the world, and all of a sudden now his life was on the line because he had metastatic malignant melanoma, which is one of the worst type of cancers that you can have.
I focused all my energy on being positive. It was difficult.
He had no symptoms at all throughout his whole ordeal with melanoma cancer.
You don't always have to have symptoms or pains or problems to have cancer.
No physical symptoms. Never lost weight, never had nausea or any of those type of things. Just the emotional, I can't believe this is happening to me and I'm scared. I don't know if I'm going to live another day.
You know, as good as our CAT scans and MRIs are, they only pick up images that are certain millimeter size or larger.
He really was a sick young man. You know, I knew eventually and down the road he was going to be okay. I knew that.
Joe's mom raised her son alone in the scorching suburbs of Phoenix, Arizona. By all accounts, his childhood was fairly normal.
Joe was a good kid growing up. He could be mischievous, but he always had a good side, sweet side to him. A little devilish at times. Sometimes he would wear my patience, but on a whole, he was a real good kid.
Joe did well in school and showed an interest in the fields of science and medicine. He was uncertain about his exact plan of action, so he enrolled in a local community college. It was about this time that the first signs of trouble began.
When I was about 2.5 years into the junior college, I was going full-time in school, and I got to a point where I needed to shift over to the major university.
My mom had passed away in October of '97. Joe and I went back there for the funeral. When we came back, he came down with a real bad cold. And that's the sickest I've ever seen him in a long time. His gland was swollen, and I personally really never thought anything about it, because when you have strep throat or, you know, a bad cold, your glands will swell.
The gland on the left side of my neck started getting larger and larger, and it stayed like that for about 6.5, 7 months.
You could definitely tell that one side was a little larger than the other.
I really just thought that the lymph node gland that was swollen was due to having the cold 2, 3, 4 months previous to that.
I kept saying, you need to go to the doctor, you need to go to the doctor. And it was like, no, I'm okay, Mom. And finally, in January of '98, I finally convinced him to go to the doctor.
I went into the primary care doctor. He ran all the blood tests, mono tests. Everything came back completely normal, so he was a little puzzled on what exactly was going on.
Joe's primary care physician decided to send him to Dr. David Sims, an ear, nose, and throat specialist.
I think he first thought it was a cyst and really nothing to be too concerned about, and he was referred to our office to have it evaluated, which is a pretty good size lump. It's like a big gumball in the outside of his neck.
He did a needle biopsy of the gland in his office that day, And at that point, I had went home and kind of went back to my regular routine of part-time school, part-time college, and then working at the computer company. And I got a phone call about 2 days later saying I needed to come back into the office. He had told me that the biopsy had showed malignant cells, possibly melanoma, that was already in the lymph node glands, and that he needed to set me up for a immediate surgery that next Friday.
We were all shocked. I mean, I was shocked and they were very shocked about the diagnosis.
Once he went to the doctor and got the news, he called me at work and said that he had malignant melanoma cancer.
The biopsy had showed malignant cells that was already in the lymph node glands. It was malignant melanoma, late stage 3, bordering stage 4.
I thought they had the wrong person. There's no way he could be sick. He's too healthy.
It's always hard to tell anybody that they have cancer, but especially if it's a young person. Especially at Joe at his age, all he was worried about was maybe the next test at school or his next job or what he's going to do that night. He really hasn't thought much about his life could be coming to an end, fairly soon.
Melanoma is the most serious form of skin cancer, a cancer that takes root in the pigment-producing skin cells called melanocytes. When the skin is exposed to too much ultraviolet light, these melanocytes can grow abnormally and uncontrollably, often becoming cancerous.
Once the skin cancer metastasizes to the lymph nodes, then the disease is essentially disseminated, widespread, because now it's in the lymph system and it can spread to all parts of your body. His chance of survival beyond 5 years is less than 10%. The problem with Joe is that we never could find where his primary lesion was. Sometimes malignant melanoma will pop up in a place at the back of the eye, maybe in a sinus, maybe at the back of the tongue. Some places it's extremely difficult to find, and if we can't find it, that even lowers his prognosis even further.
At this point, I felt, I was kind of numb, like this can't be for real.
Being told that I have malignant cells, essentially being told that you have cancer, very, very scary, and not really knowing what's next. Now I'm set up for surgery.
The fear must have been overwhelming to realize that everything that you had and all the good things that you wanted to give back to society and give back to our country is now just going to be whisked away from you.
Joe's surgery was a fairly simple procedure. To remove the affected lesion, doctors made a small incision along his neck and took out the lymph node. Still, the ordeal was wearisome.
When he did come out of the surgery, though, he was very pale and pasty looking. It was just, it was a weird sight to see. And I knew that he really was a sick young man.
After leaving the hospital, I was asked to follow up with Dr. Sims in a couple weeks from then, which I did. And during that process, I thought it was essentially a closed case. It was a done deal, so I could go back to kind of getting back on track.
For a while, it seemed like things might return to normal. Dr. Sims had Joe come back in for a routine CAT scan after a few weeks to check on his condition. The results were not favorable.
I go in, I get the CAT scan done, and about a week after the CAT scan, I then get another phone call from Dr. Sims' office stating that I need to come back into the office. And, after the first time with this, I'm already thinking, great, here we go again, another problem.
Doctors decided that results from his CAT scan indicated that Joe was at risk for the further spread of his cancer. It was determined that more tissue and lymph nodes needed to be removed. This was a much more serious surgery.
We went back and did what's called a bilateral modified radical neck dissection. So we cut his neck from ear to ear and dissected the lymph nodes in the anterior portion, the front part of his neck, on both sides to determine if any other lymph nodes had cancer in it.
Again, the surgery went really well, and pretty much just like last time is, I'm going to follow up with you the next week in the office and see how you're doing and see how you're healing up, and I don't think we have anything to worry about.
But as it turned out, Joe had plenty to worry about. The surgery had not worked out as planned, and the malignant cells had spread rapidly to other glands. He was referred to an oncologist who put him on the experimental vaccine interferon alpha-2b. The protocol was rough on Joe.
I've never felt more physically sick in my life than being on interferon. It causes you muscle pain, joint pain, nausea, vomiting, you name it. I had it.
5 times a week for 8 long months, Joe endured the horrible pain of the interferon treatments and the constant sickness it brought on. Doctors continued to monitor Joe's progress. It seemed that, finally, they had slowed the advance of the disease. But then, a previously undetected mass appeared in a late CAT scan. More cancer cells had spread to Joe's muscles. It was the worst possible news.
At this point, I'm starting to worry about dying. I was in a fight for my life.
We cried together. I remember him saying, "Mom, I'm going to die." And I go, "Like hell you are. You know, you're not going to die on my time." And I said, "If you think you want to die, then we'll go home. But if not, we're going to see Dr. Sims, and we're going to get this taken care of."
The third surgery involved what's called a radical neck dissection, which would involve removing not only the tumor, but the large muscle on the left side of his neck, as well as the internal jugular vein, all of the lymph nodes in that area, and also what's called the spinal accessory nerve, which is your 11th cranial nerve, which allows you to move your arm and your shoulder up above your head. We were forced to take the muscle, we were forced to take the internal jugular vein, but the spinal accessory nerve we were able to salvage and leave so that he did not lose the function of his left arm.
I remember upon waking up, the very first thing I did was pick my left arm up. And I had full range of motion, and I could move it all the way up, and it was the best thing. You know, again, if I hadn't been through enough at this point, the medical oncologist then tells me, "Joe, I'm going to be honest with you. You've done 3 surgeries. Your tumor has been so aggressive. I put you on an experimental vaccine or a vaccine for 8.5 months. That didn't work. What I'm recommending to you right now is that you start high-dose chemotherapy and simultaneous radiation." And then he tells me, "At the rate your cancer has spread, even doing this, you probably have a month to live, if that."
We had a lot of heartfelt conversations. I knew it was serious, but you can't be crying. You know, you have to be strong.
After everything that I had been through, and then being told this, and I had a month to live, how do you deal with it?
Joe Brown had been through 3 operations to remove the cancer, and none had worked. He tried the experimental drugs doctors had prescribed, and the disease continued to spread throughout his body. Now they wanted Joe to endure radiation and chemotherapy, despite a prognosis that gave him just 1 month to live.
I've never really been like a foo-foo type person in terms of, you know, I feel this way for this, and, you know, get those gut feelings. But I will say I had a gut feeling that chemotherapy was not what I was supposed to do. And with the prognosis, why do it?
There was no other option for Joe at this point. We'd already ruled out chemo and radiation, so there was no option.
But Joe and his family had no intention of giving up. He simply wasn't willing to poison himself anymore. He began to look outside conventional avenues for treatment.
Joe made a lot of phone calls to a lot of different people.
I was talking to anybody that I could to try to come up with some kind of solution or suggestion. Anything that was out there, I was going to consider.
And things just gradually fell in place. I mean, it just came naturally.
I started the acupuncture. I started the high-dose IV treatments. I completely changed my diet. Started juicing. I was juicing 4, 5, 6, 7 times a day.
The juicing was to build up his immune system for nutrients.
The food that we eat has vitamins and minerals in it that we actually need to sustain and to breathe and to live.
If you sat down and tried to eat the same amount that you're going to try to juice, I'm not going to do it, you're not going to do it, no one's going to do it. So juicing is really to get all of those antioxidants, vitamins into you orally.
With Joe's diet, what he put into his system was anti-inflammatory. So it decreased the inflammation, which allowed his immune system to flourish and to actually help him heal.
Joe also began to take high doses of vitamin C intravenously.
Vitamin C boosts the immune system by going into each of the cells and contributing an electron. Every cell of the human body has intelligence. Every cell wants to live. Now, that goes also for the cancer cells. They want to live. But the thing about cancer cells, when vitamin C is absorbed into them, that electron messes them up and it begins to destroy them.
Joe then tried to eradicate the cancer cells with additional vitamins and minerals.
The supplement regimen that I was put on was to try to increase white blood cells in the body, macrophage activity in the body, really stimulate immune function using a host of different oral supplements. If you can stimulate white blood cells high enough, the premise was that your immune cells will do what they should have done in the first place and kill off cancer cells.
Beyond the supplement regimen and dietary changes, Joe decided to pursue additional natural cancer treatments.
In my last surgery, they took out, when my tumor was taken out, we had it frozen at the hospital, and we sent that tumor to a clinic in Georgia where they took the tumor antigens off of it, sent those tumor antigens in a syringe back to me in a solution. They also sent a syringe full of GM-CSF and another syringe of interleukin-2. And I had to inject these syringes in the lower part of my abdomen. Premise behind this is that instead of just using a typical immune therapy, you're actually infusing the same tumor antigens or markers that come off your tumor so that you create a specific immune response to your body. The reason for the GM-CSF and interleukin-2, those are types of cytokines essentially that will help to increase immune function.
Joe's immune function was further stimulated through acupuncture sessions. After dedicating himself to this wide range of alternative treatments for nearly 5 months, scans showed that Joe Brown was cancer-free.
And this is really the first scan I've had since being told that chemo and radiation were my only other options.
Joe's recovery is nothing less than a miracle. Given this trial of fire that he had to walk through, he somewhere realized that it was on his back.
Joe Brown had little hope. Doctors had told him that after 3 cancer surgeries, he would likely survive at most another month. They had recommended he commit to a radiation and chemotherapy regimen that would make the short time he had left agonizing. When he decided to seek alternative treatments, his doctors never expected to see him again.
Approximately a year later, with no evidence of disease in his neck, I was pretty amazed that he was even alive, so we kept in touch over the next several years, and he never showed any evidence of his disease.
Dr. Sims, as well as a medical oncologist, they're saying we classify remission as of 5 years, but if you made it out this far, it's looking good for you. And that was, it's the first time that really felt like I had made it.
After the first year, he was back to himself. The cancer was gone. He's living a healthy, cancer-free lifestyle. And it was exciting, but we're going to go on now to 2, 3, 4, and life goes on.
Western medicine doesn't give the body's innate ability to actually heal itself enough credit, which is where naturopathic medicine comes in. We completely believe in the body's ability to heal itself, and we promote it every chance we get.
Joe decided that he wanted to promote the techniques that helped him regain his health. He graduated from medical school and completed a naturopathic program in Phoenix.
It was just so exciting when he graduated from Southwest.
It's the best accomplishment ever.
Joe has his own practice in Tempe, Arizona.
Patients are coming from all over the United States and all across the world, Russia, Australia, Czech Republic, with stage 3, stage 4 cancer, looking for treatments. And I'm just trying to do and give back to people the same treatment that I once desperately needed.
Joe Brown's life has come full circle. Today, he is a naturopathic physician and treats cancer patients with the same protocols that he helped develop to save his own life. The odds he overcame could not have been more extreme, but in his struggle, Joe Brown pointed the way to new and exciting means of fighting cancer. His experience is changing the way naturopaths around the world are contending with deadly forms of this disease. And thanks in large part to Joe Brown, they are able to offer new hope to their patients with cancer.